with that, now that Beverly is visible and Terry's here, let's call to order the oldest Lions Club in the world. Would you, Mark, would you start off by telling us the Zoom procedures, please?
Well, sure. Now that everybody's here, so you found your way to our meeting. The main thing is that if you are not speaking, please mute your microphone, because sometimes there's some interference that interferes with the speakers. So if you are not presently speaking, go ahead and mute yourself. And that's pretty much it.
Okay, great. Okay. Well, let's stand, and I've asked Robert Watson to lead us in the Pledge of Allegiance and the pledge to the Texas flag. Robert?
Do we have it up here?
We don't have it up yet, no. Mark looks like he's trying to get it up there.
There we go.
Yeah.
Okay, folks, I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. And for this Texas flag, honor the Texas flag. I pledge allegiance to thee, Texas, one state under God, one and indivisible. Yee-haw!
Okay, would we have some, looks like we have some guests. If you have a guest, would you introduce them, please? Gaylord, did you want to introduce your guest now or later? You're muted.
Do they know I'm here, Greg?
Glenda, I will introduce her just prior to her speaking.
Okay, all right, okay. Does anybody else have any guests that they would like to introduce? Do we have anybody that needs to be introduced? Okay. All right, well then, we have 3 birthdays this week. Actually, it's Ophelia Zapata's birthday today. I don't see her. She's probably out celebrating. But her birthday is today on the 15th. And then Molly Tower, her birthday is the 17th. And John Wisser's birthday is the 21st. So happy birthday, everybody. At some point, we'll sing happy birthday to you and maybe get you a cake or a cupcake or something. But meanwhile, happy birthday. Okay, before we start our program, I have 2 things I'd like to mention. First of all, I want to thank Ann Ward, and I don't see Ann here. Oh, there you are, Ann. And the June newsletter is just really well done. That Christian Tanner in charge of it did a good job. And I recommend that everybody just go on to Austin, Downtown Lions Club, and click on the newsletters and read it. There's some good pictures, and it's very, very well done. Thank you for getting that, Patty. Yeah, okay. And then before we start our program, is Sam Ruiz there? I don't see Sam anywhere. Sam was going to talk with us about, he did a vision screening last night at Houston Elementary, but he's not here, so maybe he'll be here a little bit later.
He's here, but he's muted.
Oh, I don't see him either. Oh, maybe he's
just the letter S. We know him as Superman.
Oh, he's over here on another screen. Okay. Okay. Sam, did you want to talk with us just a minute about your meeting last night?
He may have stepped away. There he is.
Okay, can you hear me now?
Yeah.
Yes.
Hello, can you hear me? Yeah, I'm going with audio instead of video. Yes, yesterday I went to Houston Elementary, and I was invited by Ms. Zapata, as you know, from the school board. And I was there from 5 to 8 o'clock. I decided to go by myself because I'm a little concerned about this Delta virus and see where we are. So I was able to see 50 clients, And the reason that she was having the session was these people were invited to get their vaccinations. I thought it was going to be some type of other type of meeting, but all these people showed up to get their vaccinations, either their first ones or their second one. And so we were able to get them come in. And of course I was double masked, and we had a good time. And we wound up getting about 7 to 8 serious anomalies, and we're going to get them vouchers, and we've got vouchers for them, and we're going to get them glasses, and it turned out to be very, very successful. And I'm really glad I went to see the vaccinations occurring, and after they finished their vaccinations, they came over to me, and I was able to do the screening.
Well, thank you, Sam. That's a wonderful service that you did. And that goes into our kind of our segue for our next speaker. For our speaker for today. And Gaylord, would you introduce our speaker to us? You're muted though.
Yes, just a minute, Glenda.
Okay.
Glenda, while we're waiting on Gaylord, may I give a little announcement?
Yes, you may.
Okay, well, I want to give a shout out to Mark Hastings. He has gotten both of our fundraisers up on our website, and the sporting clay is our first, it comes up first on September the 17th. And we're soliciting teams and sponsors and volunteers to work with us that day. And so all the details are online. And then Mark also got casino night up, and you can go on there and purchase sponsorships, and you can also purchase tickets. So just thank you, Mark. It looks really great. And I'm getting some feedback from the sporting clay participants, so I know that there's some interest. Thank you.
And I went on.
Here it is.
The finest thing, you've got to go into the calendar and into the month of September. I hope you put it out.
No, you don't. That's what Mark has done. Mark, go up to the top so they can see the home page.
I was on the homepage a while ago.
Well, you may have to reload it, but it is on the home page now. This is what we're looking at on your screen. And Mark has put these pictures. There's some pictures from Sporting Clay. And then if you scroll on down and see there, it tells you about it. And there's a link that takes you to the splash page. And then here's last time's casino night. And again, there's a place that you can click and get more information. And it's right on the home page. And then when you click, they take you to these splash pages. So thank you, Mark, for doing that.
I have a question about the tickets. If they order tickets online, do they get the tickets at the door, or are the tickets mailed to them?
Well, I don't know that we've decided. I think in the past, of course, we were meeting in person. We gave them out to people at the meetings. And then we did mail some to other people.
Okay, well, we can discuss that later then. But
Yeah.
I don't want people to show up and not be able to get in because they don't have their tickets.
Right. But we
Okay.
have a list of who's registered.
Right. Well, do we have anything else that needs to be brought up before Gaylord introduces our speaker?
Yes, I would like to mention something real quick. I had previously canceled the Saturday casino night committee meeting at my house, but since the new Lion orientation has been canceled, then I would like to go ahead and reinstate the Saturday casino night. So I'll send everyone an invite.
Okay. Well, thank you very much. All right. So I guess Gaylord, I think we're ready for you to introduce our
All right.
speaker.
Very good. I have a very, very special honor to introduce our speaker today. There's not been a topic probably that's dominated the attention of not just the Austin, Travis County area and the state and the nation and even the world as the coronavirus and COVID-19 concerns, to say the least. And we're blessed today to have our local authority literally on the topic. Dr. Desmar Walkes is the new medical director and health authority for Austin Travis County. She comes to us after 30 years of clinical experience as a physician and 13 years previously as the health authority and medical director for Bastrop and Bastrop County. I've been so impressed with the opportunity to get to know and to meet with Dr. Walkes and with others. And what a very critical time, because as of today, she joins us from having met with the mayor and other members of the city council and staff on the fact that Austin Travis County, unfortunately, is now having to move back from stage 2 to stage 3 in the risk assessment that is used to gauge how we should conduct ourselves in public. I welcome you, Dr. Walkes, and bless you for the work that you're doing. Tell us somewhat, give us a little bit of the background about your team and also public health, and then move forward to an update on where we are during the pandemic, and particularly the new stage 3 risk assessment.
Good afternoon, everyone. I thank you all for having me this afternoon. I'm very happy to be in Travis County. I've taken on the responsibility of medical director and health authority here, and I'm blessed to be surrounded by an amazing team of talented, very highly qualified individuals who have shepherded this community through a response to COVID-19. And I wanted to take some time to explain all of the inner workings of the beast, so to speak, that many are not aware of, because you just don't get to see what happens behind the scenes. And I think public health in general has had more of a light shone on it since this pandemic began. And there's now a recognition of the importance of public health. I think that that's good and bad. Everything always has two sides to it. One is that you now see where some of those weaknesses may be, and we may need some more funding and shoring up of resources. But all in all, I can tell you that I am surrounded by people that are dedicated servants, public servants. And there are some here who have come out of retirement to join the fight for this community and getting us through this pandemic. So I want you to know that you've been in very good hands throughout the pandemic, and I'm honored to be a part of this team. I was looking at your website, and the Austin Founders Lions Club, as was mentioned at the very beginning, is the oldest Lions Club in the world. I am fortunate to be the daughter of a man who's been part of the Lions organization. My godfather's been a member of the Lions Club, and many of our family friends have been. So I'm aware of how this organization prides itself in community service. And as the world's oldest Lions Club, you are the genesis of the spirit and the story of the Lions Club's commitment to answering the needs of the community and of disadvantaged groups and individuals. Lions Club International, from my reading, supports nonpartisan service opportunities on a worldwide scope. And that dedication to community service and those volunteer efforts that your community of Lions produces and supports is really what humanity is going to need now as we try to bring ourselves back from probably one of the worst events of modern time. In December of 2019, reports began to reach our shores about a viral illness that was spreading quickly, as we all know, and that happened right before Thanksgiving. And I remember that I would be in the room with patients, and we'd be really just paying a lot of attention to all of the things we had to do to get ready for the holidays. The turkey for Thanksgiving, the Christmas tree for Christmas, and the gifts for Santa, and seeing our grandkids and ringing in the new year. And we didn't really pay a whole lot of attention to that news report, I think, because we were wrapped up in the holidays. We as medical and public health professionals were discussing the situation in China, and then we'd return to our normal lives. We really kind of thought that it wasn't going to reach our shores because we had dealt with Ebola when that started, and we'd been able to keep anything from happening here. The sights and the sounds of the season continued. And then I remember personally, as the public health authority in Bastrop, receiving a call in late January, early February, where a person that had been traveling in Wuhan had returned to Bastrop County. And because they had been in that area, they were considered to be a person under monitoring. And that was when time stood still, really. I understood then what that meant, and got my directions from the State Department of State Health Services. And luckily that person did not develop COVID-19, but several weeks later, we had our first case, and life hasn't been the same since then. Thinking about it now, those in public health had no idea that our world would be in a free fall, so to speak, because of this pandemic. We as clinicians and public health professionals, emergency management professionals, and policymakers had no idea what this call or situations like this were going to herald for us. Before coming to Austin as the health authority, I spent time working with emergency management operations personnel, initially trying to secure PPE and develop plans for measures that we would need to provide isolation facilities and sheltering for people that couldn't safely stay at home in a room by themselves with their own bathroom. We had to figure out how we were going to get control orders to people's homes without exposing the people that delivered those orders. We had to talk about things like, are we going to implement any kind of legal ramifications if those orders were not followed? We needed to identify volunteer organizations that would help provide food. We gathered together as a medical community in Bastrop when we had no testing and called on each of the offices and asked them to donate viral transport median specimens so we could set up a drive-through test site and gather our school nurses who were not working at the time because schools were closed and ask them to staff those drive-through sites. Austin Public Health did the neighborly thing, and when they got their mask on first, as they say on the airplane, when they got their testing platform up and running, reached out to us and allowed us to share the use of that test platform through an interlocum agreement. And we were then able to streamline our process so that people could be tested and identified and isolated, and then given resources as needed. All along the way, volunteers played an amazing part of that, they provided us help during that response and still do today. The first meeting at our incident command happened last March in Bastrop County, and the room was full of people. There were police officers, EMS, first responders, emergency management personnel, Homeland Security personnel. We even had HEB there. And if you recall, early on, HEB was featured in a Texas Monthly article for that, because they had sent a team over to China to find out what best practices were for businesses. We had volunteers, and I keep going back to that because the crux of the matter is when you're in a situation where you have to deploy a lot of people, you often don't have enough people to get a lot of what needs to be done to reach as many people as you need to. And so the core of any good response is going to be the ability to have volunteers help. When we got into the January timeframe and vaccines were available, again, volunteers came to help, particularly out in Bastrop, where we don't have a formal health department. We amassed a coalition early on with the help and organization provided through APH, who's throughout this pandemic response reached out to its neighboring counties and formulated plans to best reach out to men and women in our communities and children now to give them vaccine shots. Volunteers from an organization called Bastrop County Cares stepped up and provided logistical support, data engineering, and computer engineering support to handle large volumes of data, thousands and thousands of records, to send out in electronic texts, emails, and then to do data entry into the state's system for reporting and recording immunization shots that are given, as well as working clinics on the ground, greeting patients, answering questions, allaying their fears about vaccines hurting them and vaccine safety. And personally, the very first day that this response started, a retired epidemiologist who had served as the state epidemiologist for the state of Texas and has worked in Ebola and at the CDC, walked up to me and offered his help in epidemiologic analysis of data throughout the response. And to him, I'm eternally grateful for his help in helping to provide that response. So now, as we look at where we are, I heard one of the members talking about being at a school function last night and providing back to school eye evaluations after folks had been vaccinated. And that's part of that community infrastructure that has brought Austin through this response. APH delivers so many different services. We have a refugee clinic in the Clarksville area, and we provide help for day workers. We oversee HIV and sexually transmitted disease clinics, and we have a chronic disease management service and community workers and nurses that call and oversee maternal and infant child issues. Our environmental health services branch is responsible for helping to make sure that businesses comply with the guidances that are in place. And then we have epidemiology and disease surveillance services that are currently looking at this COVID-19 pandemic response, and case evaluations and investigations are ongoing. But all along, they've been monitoring things like Legionella and TB and syphilis, and the list goes on and on. So that's the infrastructure of Austin Public Health and its knowledge of this community is what was brought to this emergency situation. And there have been challenges along the way that have been presented that have required resources, but under the leadership of the policymakers in Travis County and in the city, those challenges have been met with swiftly and resolved swiftly. And along the way, we've been able to help almost 500,000 people receive vaccinations through not just APH, but our community partners. And we've been able to test thousands and thousands of individuals, provide food, provide personal protective equipment, and ultimately allow our community.
What? I had to go on my calendar for 1:30. Oh, okay.
And ultimately allow our community to reduce the number of cases and the spread of COVID-19. Having said that, we have a new fight on our hands. The Delta variant is a much more contagious form of COVID-19, as you've heard. It spreads much more rapidly. And we've had two spikes, one last July and one in January. And the July spike was overcome by this community joining together to do what was necessary to decrease spread by social distancing and wearing masks and washing hands and staying home when sick. The one in January was managed in a similar fashion, and aligned with that, we were starting to vaccinate our seniors and our healthcare professionals. And we've done an excellent job of getting our senior population identified as the most vulnerable population to severe disease and illness vaccinated. But we still have work to do in our vulnerable communities. We've got 20% of our population that hasn't been protected by being vaccinated to COVID-19. In our communities of color on the east side of I-35 have been more impacted by severe disease, hospitalizations, and death. And in Travis County, we currently have 85,787 cases confirmed by PCR of COVID-19. Today, we have 171 new cases. We have 152 people in hospital who are sick with COVID-19, and 49 of those folks are in ICU settings. 23 of them are on ventilators. Our DSHS reports today that we have 50 available ICU beds at this point. Now, our original projections were based upon our having 200 ICU bed capacity across our hospital systems. So you ask, why am I saying we only have 50 left and we only have 49 in the ICU right now? Well, that is because we've lost some staff along the way. We have men and women who are medical professionals who have been fighting this fight since last year. So after 18 months and a lot of caregiving and caregiver fatigue, we've lost some people to retirement, and some have just moved on. So Today, we made the decision to change our staging to stage 3, which is giving the community the sense of urgency about protecting themselves, doing what they've been doing to keep from getting COVID, wearing masks and so on, but also getting those who have not been vaccinated to go and get vaccinated. Blacks make up 8.3% of the population in Travis County, and during this pandemic, 10.5% of them have died, and 11.0% of the cases of COVID have been in the Black population. Hispanics make up 23% of the population, and they've had 46% of the cases of COVID-19. And if you look at our map now of where a vaccine needs to be delivered with haste, it's in those populations that we've spoken about on east of I-35. So the efforts of our volunteers going out to the communities, getting our school children vaccinated so we can open schools safely, pushing the message to wear masks, and for all of you to lead by example, call your friends and family and ask them to be vaccinated if they haven't already done so, is going to be key to us getting to the end of this pandemic. And when it's over, when we've had no cases in 2 incubation periods, which would be 28 days, we're going to need the strength of your leadership and your volunteer spirit. That's going to be worth more than any money that we can throw at the problem. That's what's going to get us through this and get us back to where we were economically and spiritually as a community. And with that, I thank you for the opportunity to speak to you, and thank you for inviting me, Gaylord.
Well, thank you for first agreeing to be our medical director as well as health authority for Austin Public Health. And you reported to the Commissioner's Court, as so it was reported, that your goal is to have 70% of Austin and Travis County residents 12 years of age and older vaccinated by September 1. That's a pretty ambitious goal. You may have mentioned, and I apologize, I'm having some work done here to my residence that's kind of distracting and a little noisy. You may have mentioned this, but how do you rate Austin and Travis County, and what are our numbers now on those that have received 1 vaccination as well as those that are fully vaccinated?
So as of today, we have, I'm going to look that up because I didn't write that down. If you'll give me a second here. We have 20% of our population fully that have not been vaccinated. And that represents 20% of 1,274,000 individuals. And that's the number of people that we need to reach out to get vaccinated.
So are you saying that 80% of the population in Austin Travis are vaccinated?
No, sir. Let me explain that. We've got a calculator that we use, and we've got 85,000 plus people who've had COVID, and they have some immunity that they build up as a result of having COVID. It's not long lasting, so we'd like them to be vaccinated as well. We estimate that there are about twice that many that have COVID who've not been diagnosed. So they're going to have some immunity, and we're not going to know that they're out there, but they need to be vaccinated too. And then we've got our vulnerable population that we know haven't been vaccinated. Fully vaccinated, we have 665,000. So that's 52% of our population that's fully vaccinated. And we've got 7.8% of the population that's partially vaccinated. So all in all, all in all, we're going to need to really get more people vaccinated. And it's now happening very slowly because vaccines widely available and the urgency is gone. So now we're trying to turn our attention to one-on-one communications with people that have had the vaccine and had good results, no bad adverse events have happened, to ask them to reach out to the people on their Rolodex and start educating folks about the safety of vaccine. The vaccine works to protect people from severe disease and illness, and it's going to be the key to getting past this Delta variant. Almost all of the people that are being hospitalized right now are unvaccinated. And as long as there are bodies in our community that have not received a vaccination and don't have antibodies to fight off an infection, and the virus has a chance to replicate itself, we're going to have COVID. And as long as there's that chance of replication, there's that chance of mutation, and we may have more mutations and variants that develop. So we're trying to get as many people vaccinated as we can, including people who've had COVID, to be vaccinated.
Dr. Walkes, what from your experience, we hear a lot on the state and nationwide level, what do you see as the reason why there is resistance to being vaccinated?
We've had a lot of, actually some anecdotal reports and then some scientific papers that have been published recently. And there are numerous reasons for it. One of the reasons, particularly in the essential worker population, is that they are hesitant to get a vaccine because they don't want to miss work. And they've been told that some people are thinking that they're going to have to take off time from work either to go get the shot, or they'll have symptoms and not be able to go to work because of the symptoms. Some people are nervous about what's going to happen from the standpoint of some of the reports that have been made of the side effects that are affecting children. And we've done some investigation of those reports of inflammation of the heart and the lining around the heart. And those instances of those types of side effects are very, very minimal. And we've done an analysis, and the risks are far less than the benefits of being vaccinated. Others are concerned about where to go and get the vaccination and are afraid to go and present for the vaccine because they think they may have to pay for it. Vaccine is free. Or they're afraid that they're going to be arrested because they don't have the proper documentation. They don't have to have documentation to receive the vaccination. So there are many, many different factors that are affecting people going to get the vaccine.
I have a question here, if you don't mind, Doctor, on our chat. It's one of our colleagues, but he can't get his video working. He says, this morning I saw a rant on social media demanding the imprisonment of Dr. Fauci for treason. Have you or any of your staff personally experienced any threats against yourself or your family?
Yes, but those things happen when you're in a volatile situation such as this. And I think we're all people that understand that you do what you have to do in life and you don't spend a lot of time being nervous about those types of things. So.
Well, thank you. Thank you for answering. And sorry about that.
That's okay.
Mac, could you go ahead, please?
Yeah, Dr. Walkes, when you're not fighting pandemics, what are you and Austin Public Health doing?
We are conducting the clinics that I mentioned to identify and start treatment for HIV. We have a TB clinic that treats TB patients. We're going out in the community and doing health prevention seminars and trying to help mothers with breastfeeding and prenatal care. We have a refugee clinic that helps to, get refugees the help that they need to establish themselves in this country. And we go around inspecting restaurants. We are the preparedness arm for any kind of bioterrorism that and threats of bioterrorism. We have ongoing monitoring throughout our community to make sure that there aren't any bioterrorist type agents that are being detected. So it's a long list of things that happen behind the scenes.
Dr. Waltz, I have a couple of things I want to ask you. First of all, and my name is Glenda Summers. You made the Todd and Don show this morning on KLBJ.
I did.
Yeah. And so I thought, well, I know who they're talking about. They were just mentioning some of the statistics that you quoted, but I thought, I know who they're talking about. Two questions. I've been fully vaccinated for a long time. So when I go out now, it says you don't have to wear a mask, but should I be wearing a mask because of the other things or not? I vacillate. Sometimes I do and sometimes I don't.
Well, the way I look at it is I was vaccinated at the beginning with the other healthcare providers, and I'm high risk because of my age and I have high blood pressure. So when I'm out and about, I'd use a mask as an extra layer of protection. If I'm in a place with my family who's all been vaccinated, I don't wear a mask. But if I'm somewhere where I don't know if everybody's been vaccinated, I wear one. And I don't think nobody's told us we can't wear a mask. They've just told us we don't have to. So I think you can make that personal decision to do so, and I support that. We do know that, we all remember our mothers teaching us to cover our coughs when we were kids. Mm-hmm. And this year with mask wearing, we've had very little incidence of flu disease. And as soon as masking was stopped, we've started seeing much more respiratory illness. So it's not a fashion statement, but it may be a health statement, right?
Right.
Well,
right.
Some people have made it that. They've made some pretty decorative ones. So.
Absolutely, absolutely. Well, one more question. I have a 10-year-old grandson, and obviously they can't be vaccinated till they're 12. I guess I should wear a mask around him, or what would you, because he hasn't had the opportunity to be vaccinated.
I think you need to think about what your risk is when you're in this situation. You've been vaccinated, and the vaccine will protect you from severe disease and hospitalization and death. So you're fully vaccinated. So I think that, for right now, you should be fine because you're vaccinated. But, that again, it doesn't hurt to have an extra layer of protection if he comes down with the sniffles or whatever to protect yourself if you come upon that kind of situation. But right now the guidance is for high risk individuals to avoid situations where ventilation's not good and That would be like in an airplane or indoor such situation, or a large gathering outdoors where there are more than 2,500 people, that kind of thing.
And I do have one more question. I just said two, but I have three. I'm a hugger. I just want to go up and hug people. Is that stupid?
I'm a hugger too. This has been the hardest thing
I
ever.
know it's been so hard.
Yeah. I don't know. I think that, again, the same thing applies. You know, you're vaccinated right now, and you're going to be probably hugging people, you know, so
Okay.
I think you'll be fine.
All right. Okay.
And when flying
ahead.
on an airplane, is an N95 better than a regular mask?
Yes, it would give you more protection.
I have a question. Could you address the issue for children? I've heard conflicting reports about the ages that the vaccine is safe for. And so what is the recommendation in terms of children vaccination?
Children aged 12 and older can be vaccinated with Pfizer vaccine.
And the other vaccines shouldn't be used on children?
They've not been approved yet for children, for use in children in this country.
Do we know, doctor, if in September the vaccine for 6 years and older will be ready to go, or is it still delayed?
We're still
I have an
waiting.
8-year-old and she's starting to go to school, so we're debating.
Yeah, we've not received word yet as to whether or not it will be approved below age 12 yet, but we are all waiting for that to happen. I have grandkids that I really want to see vaccinated before they get back to school.
Thank you.
Thank you.
Patty, you had a question?
Yes. For those people that are immune compromised, for maybe cancer treatment or just other diseases that they may have, does the vaccination protect them against COVID-19?
It does protect immune compromised individuals, but they may not have as robust an antibody response and not produce as much antibody. So that would make their protection a little bit less. And that's why we're saying, you know, to avoid situations where you may be exposed. And we should be doing that anyway, just as a matter of course. And if we have to be in a situation where that's happening, wear a mask. I wear my mask when I'm treating patients in the clinic, you know, so.
Thank you.
Thank you.
Is there an easy way to determine if an N95 mask is bona fide or if it's a fake?
You can actually look on the box and get the number that's the manufacturer, and look on the CDC website or the Department of State Health Services website and see which masks are approved as N95 compatible.
Excuse me, I have a question.
Yes, sir.
Thank you very much. Your presentation has been fabulous, very to the point, with a lot of detail and accuracy, and I really appreciate that. And I think we all do. I was wondering though, my wife and I were very particular nowadays when we do get away and we get to restaurants.
Mm-hmm.
So I was wondering what's the APH's, what we call policy or regulations with relation to food preparation. My wife, every time she goes to, let's say, a grocery store and she sees them cutting the meat behind the counter, if she sees them without masks, she turns to me and she says, should these guys be reported, or what's the ruling? Why should they not be wearing masks? And we've seen it in places as simple as HEB or other locations. So is it just basically now all of the groceries, all the restaurants, and with regard to handling of food or preparation, again, it's a question of volunteer or optional?
So we have had some changes as far as what has been brought up by the state and the recent changes in the legislative body. So some of what you're seeing may be as a result of that. Normal food handling practices are still the same. And so if you have some concerns, I would raise that with the store manager or the manager of the business establishment where you are. And you can always also voice your concerns with APH, and someone can look into that for you.
Thank you. Appreciate that.
You're welcome.
I have a question for you. With the surge in this Delta variant, is there any chance, and maybe the medical community, considering that there may be another variant to follow along that might be even more problematic, that might cause bigger problems?
Yes, that's always a concern. Because as you know, the thing that's the strongest that can evade the medications that we're using and the means that we're using to keep it from surviving is going to live. And so a mutation that can evade the current medications is going to be a mutation that we're going to be concerned about.
So it's another argument for more people should be vaccinated.
Yes, sir. Definitely. Definitely.
I have another question. I'm Ann Ward, by the way, and thank you. This is very interesting. I've heard on the news that Pfizer, I believe it is, has developed the third dose, but it's not yet approved. And they said, what I heard latest was that maybe in the fall, people who were vaccinated early might need to get the third dose. And can you talk about that at all? You know, like what would I got vaccinated, my second shot was on February the 5th. So I was pretty early. And, you know, it's already coming up on 6 months. And I just wonder, you know, what to expect if I have to get another one. Is it likely to make me sick? Or I didn't have any reactions to the first two, but.
We haven't received guidance from the Advisory Committee on Immunization Practices, FDA, with regards to booster shots at this point. And so that's not something that we are advising as of now. With regards to whether or not you will have any kind of illness after the third shot, we have not gotten any guidance on the sequelae after the third shot officially, but it usually is mild and some similar to what people have experienced with the second shots from research that I've been reading. So, but right now we're not recommending a booster shot at this time.
I see John Neesler with a hand up. Go ahead, John.
Yes, I'd like to go back to the earlier question about the practice that's been observed, for example, for the example that's been given for a butcher in the grocery or the supermarket. Do I understand that your response to that question was that the Texas legislature has passed some statutes that permit practices that do not conform to the best medical recommendations?
Not the, well, I said legislative body. We have orders that have been submitted that lifted mask mandating. And so that's what I was referring to when I was talking about that.
But that would perhaps not the legislature, but
The
the
legislative
Texas
body.
government taken as in
Mhm.
total.
Yes.
I think
Yes.
I understand what that means. Thank you very much.
With no names mentioned. Yeah.
Question.
Siva, I think Siva has a question.
Yes, thank you. Thank you. Doctor, I'm Siva here. So when the first wave started last year, Feb and March, it only impacted certain age people or young people with some chronic problems, lungs or kidneys or something. And when the second wave, especially, I'm sure you are aware, in India, like a month ago, young people who are in young early 20s, they got infected and they died. And to my knowledge, they do not have any chronic disease, or they don't smoke, or they're not heavy drinkers. I mean, what is the current state? I mean, the latest Delta, it still affect the young people with no chronic disease, or is it only affecting certain age people with some existing health problems?
It's affecting, it seems to be affecting people across the board. What stands out in the literature is that there seems to be more inflammation in the lungs with that variant. And so there will be more to come as we tease through the data and look and see what might be causing what we're seeing in various parts of the world as a result of the Delta variant.
I have a quick question. My name is Sid Popinski. We are beginning to go out to theaters, and with the third stage now being called today, is this something we should reconsider as we plan our next week?
I would take the opportunity to give yourself as much protection as possible. If you're not sure about where you are in your surroundings and that everybody's vaccinated, you might give yourself that extra protection of wearing a mask if you're fully vaccinated.
Okay, thank you. And thank you for today.
Thank you.
Enjoyed your talk.
Thank
Leonore, you had a question?
Doctor, maybe this would be the last one. Do you know if AISD is currently thinking about going virtual again, since not all the kids are going to be vaccinated and we have this spike again?
No, we're not hearing that. We are, everybody's, looking at the situation. We're hoping that we've taken action early enough so that we can get this thing back under control. But as it stands, the plan is to go back to full in-person instruction.
Maybe a way to kind of wrap up. It seems the ultimate goal is something called herd immunity. And I know you had mentioned, particularly to the Commissioner's Court, that your goal for September 1 was to have 70% of all Austin and Travis County residents over the age of 12 vaccinated. Explain to us laypersons what herd immunity really means, and given the fact that seems to be the ultimate goal that we would hope we could reach with a sufficient number of vaccinations or those that are immune for other reasons.
Sure. I'm going to use an analogy that's near and dear, not dear, but near to my heart. Coming from Bastrop, we've had a bunch of fires. And if we have fuel, we have fire. And in the case of this pandemic, fuel is human body, beings that are unvaccinated. So herd immunity would be a situation where we have enough people vaccinated and enough people with immunity that the virus has nowhere to go and can no longer be a problem in our society. And that can be achieved by vaccinations and to some extent by those people who have had COVID-19 and have natural immunity after the infection. But I have to also add as a caveat that if it's been longer than 90 days, we do not have confidence that there's sufficient antibody production from a natural infection. So we're still asking people who have had COVID-19 to be vaccinated. And if you look on that risk guidance sheet that we have out now, we've given ourselves a 70 to 90% range because we know that we may have to adjust our target as we have different variants in our community that are causing disease. And so we'll look at it in the coming days, but our target of 70 may have to go up to something like 80 to 85%, depending on what the impact of the variants are.
Alan Ford had a question. Alan, are you on? He said he couldn't get his video to work, but he had a question for you.
I've made his question, Glenda.
No, mine was the one that Leo raised. I appreciate that.
Okay.
Dr. Wells, I'd like to invite you to join our membership, and we would unanimously nominate Gaylord to be your sponsor. So we would really enjoy having you as a member if you would consider that. You certainly have a legacy of members, Lions members that you're aware of.
Yeah, thank you. Thank you so much. That would be an honor. Thank you. Thank you.
Welcome, Dr. Walkes.
Thank you.
Thank you. Thank you. Thank you. Well, this has been fascinating, fascinating. Thank you so much, Gaylord, for getting such a wonderful speaker. And for getting, we look forward to her becoming a member.
Thank you.
Yes.
Thank you.
Now, Gaylord, would you, I think you have next week's program also, is that correct?
We're having to make an adjustment. Our speaker for next week was to be the executive editor of Texas Tribune, Ross Ramsey, and his wife has been scheduled as of this morning for emergency surgery on Thursday. And so Mac and Leo and Mark and I are communicating about a substitute. So there'll be a change that you'll receive a notice of in the near future.
Is that going to be Baylor baseball, Gaylord? Is that what we're going to do?
We prefer to talk about Baylor men's basketball these days.
Oh, okay.
The national champs.
Well, before we adjourn, I just want to point out a couple of things on the agenda. On the 24th, we have a district cabinet meeting in Pflugerville. And on the 29th, we have a social at the Moon Tower at 5:30. On August 5th, we have the Harry Wickersham Golf Tournament to benefit Texas Lions Camp. And on August the 28th, Tommy Cowan is having a birthday party at his lake house. And don't forget on the September the 17th and the 24th and 17th, the Sporting Clay fundraiser. And on the 24th, the casino night fundraiser. And I hope you're all out there working to get prizes and sponsors.
You see, Dr. Wells, we do have fun too.
That
sounds like it.
So is there anything else for the good of Lionism? If not, we will adjourn and give ourselves a few minutes before we go into our board meeting.
Thank you. Bye.
Board members just stay online and we'll